Activity in the hamstrings can mask an ACL tear or give you a false negative. Potpourri for 5. Middle.
It's the ACL, the MCL, and the medial meniscus.
Nice job. Well done.
Good, Jay.
Nice save. Yeah.
ACL, MCL, medial meniscus. That's the unhappy triad.
Medial meniscus is the big one, right?
What's that?
That's the bigger one.
That's
right?
the big one. That's the open C shape, yes. And it attaches to the medial collateral ligament. So they didn't say that that Marcus Lattimore guy had medial meniscus problems, but I'll bet you he did as well. So if he tore his medial collateral ligament, he probably took a piece of meniscus with it.
Somebody's call.
Knee potpourri for 2. Fast.
It's the PCL and the LCL.
Nice job. PCL and LCL.
We were so much more prepared than last week.
Injured less frequently.
PCL and LCL or MCL?
Unless you're
No,
Marcus Lattimore.
PCL and LCL are the two least frequently.
Least frequently injured, yeah.
Oh, okay.
So ACL, MCL get injured quite a bit. LCL, PCL are rare, unless you're RG3 or Marcus Lattimore. What do you like next? 100? Valgus, nice job. Knock knee,
Yeah,
valgus.
I mean, if we're going to lose one, that's going to
Bow-legged,
lose.
varus. Knee muscles for 3.
Rectus femoris, there we go.
That's good.
He just said it.
Rectus
Yeah, rectus femoris.
The only 2-joint quadricep muscle is rectus femoris. Good.
For some reason, there was a Q stuck in my head. 400.
4? Popliteus or popliteus. Both of those would work. So it's that tiny little muscle just on the posterior side of your knee joint here, which internally rotates the knee slightly and flexes it. So that just gets it out of the locked position. When you're in full extension, your knee's locked, so you have to rotate it a little bit and then flex it a little bit so that the hamstrings can take over. So it's the knee unlocker, basically. Popliteus. Popliteus, however you want to say it. 200. Nice job. Semimembranosus, semitendinosus, biceps femoris are the 3 hamstring muscles. Make sure you know that. I can guarantee you 100% that will be a question on your test. $500? Yeah. Be more specific. What head?
Long one.
On the process of elimination. The
Long
short
one,
head
long
of
one
your
means
biceps
cover
femoris.
words.
So remember, the long head of your biceps femoris is a true hamstring muscle. Originates from ischial tuberosity and crosses the knee on the posterior side. The short head of your biceps femoris just originates from the proximal part of the femur. So it doesn't cross the hip joint. So what can it not do?
Hip flexion.
Hip extension, right? It can't do anything to the hip. It can only flex the knee. So biceps femoris short head is a 1-joint knee flexor. That's it. Can't do anything to the hip. So it's not considered to be a true hamstring muscle. So when I ask you what the hamstrings are, really you should tell me semimembranosus, semitendinosus, and the long head of the biceps femoris. If we're going to get technical. Good. Well, that's here. For how much? 100? Alright. Hang on, do it again.
Vastus medialis.
Yeah. Good.
Vastus lateralis.
Good. Perfect. Wasn't sure that I heard it correct, but okay. So the three one-joint quadricep muscles are all the vasti muscles: vastus medialis, vastus intermedius, and vastus lateralis. All they can do is extend the knee. That's it. 4. Proximal femur. Good job. So all the one-joint quadricep muscles, all those vasti muscles, just come from the top part of the femur. That's all you need to know. Proximal part of the femur. 5.
Tell it.
No.
No!
Tibia. Good. Good. Tibia. So remember, we got 4. Remember we told you to feel behind your knee? We got 1 string on the lateral side. What's that? That's biceps femoris. What's on the medial side? We got a bunch of strings. So we got semitendinosus, semimembranosus, gracilis, and sartorius. And they all come down and just insert on the posterior side of the tibia. Biceps femoris. Whatever. It should be, yeah. Or it could be both. Same muscle. All those muscles listed up there, insert on the tibia. Yeah, I should have put semimembranosus. So remember, those 4 muscles come down posterior to the knee on the medial side. 4. Right here.
The medial side.
That's it. Stop. Good. So remember, the medial compartment, if you look down on top of your knee, the medial side's big, the lateral side's small. So it bears most of the weight. 300. Tibial plateau. Nice job. So remember, if we look at our tibia along the top, it's basically like a flat surface. So we call that the plateau or the tibial plateau. Two. The fibula. Not part of the knee joint, does not bear any weight. So the knee joint is basically considered the femur and the tibia, with the patella sitting on top of it. The fibula not considered to be part of the knee joint. 500?
Tell it.
Patella, nice job.
There's my P word.
That just makes the amount of torque that you can generate in your knee greater by making that wrench longer. And 100.
Quadriceps. No.
Tuberosity. Nice job. So remember, all your quadricep muscles come into the superior pole of the patella. So vastus lateralis, vastus intermedius, vastus femoris, and vastus medialis. They all come in and they pull up on the patella, which then pulls up on the patellar tendon, which comes down and inserts on that little bump on the front of your knee called the tibial tuberosity. So that pulls everything forward. Tibial tuberosity is where the patellar tendon is. All right, have a great weekend.